Sleep, I'm tired. I'm always tired, like beyond tired. I think I just got to a point where I couldn't like fathom how I was gonna keep going. Like, how can I lead a normal life? How would I ever work a full-time job, come home, make dinner, do all these things? Like, I reached a breaking point, I think. I actually ended up going to for a sleep study, or to a pain and sleep therapy center is what it was called, thinking that I must have a sleep disorder. I tried a few things over the years and I didn't get any answers. I was negative for obstructive sleep apnea. On the final tests after, right after palate expansion, I did another sleep apnea test. They did pick up sleep apnea and it was mild, but I could see like the difference and I could feel the difference after the palate expansion. The biggest ones was like, yeah, sleep. I wake up a lot. I'm always tired. At the point that I seeked help, I was sleeping, I want to say 10 to 11 hours a night. And then I was sleeping maybe a 1 to 2 hour afternoon nap as well. I was also put on previously to seeking this help. I've been on Vyvanse and Adderall, which are both stimulants. I'm on the maximum dose of Vyvanse, and despite these medications, I was still struggling. So those were the biggest concerns for me. But through understanding my condition, I now know how many symptoms are actually based on it. I have problems with food, chewing food, swallowing food. Food often gets caught in my throat. I had very hard time swallowing pills. So prior to the MARPE, I had a septorhinoplasty done. It was a badly deviated septum that was mostly hidden, I think. But despite the rhinoplasty, I still couldn't breathe through my nose very well, but for the first time in my life, I could breathe through at least one side reasonably well. So that changed my life, but wasn't enough. And I honestly feel like I can breathe through both nostrils since the MARPE, which is great. Nasal breathing's been huge, because beforehand that was just only one. Now I have two. A lot of people out there who don't know that you can still expand as an adult. There's a lot of misinformation there. And a lot of people think there has to be some kind of surgical intervention, but yeah, I found out about it. I looked into it and I found out that there was a custom expansion, which is exactly what Dr. Evans uses, and that it didn't require, there's absolutely no need to be going through the addition of having a surgical incision made prior to the expansion. When the expansion devices made specifically for your mouth, then they can pinpoint exactly where to put the points on there. So you can expand without having to go through the surgical prospect first. I had zero issues. I think I expanded really fast, actually. Within like 3 weeks, there was this massive gap. No issues with the split opening up. I think wherever they planned to put everything in, it worked perfectly fine. I don't recall there being a specific moment where it just suddenly went. I think it just did it nice and slow and easy. The only big problems that I had involved with MARPE was the screws. And I don't know if this is to do with my anatomy, but the screws felt like longer on my tongue, I guess because my tongue sits, you know, I got the higher arch, I got I feel like a tongue that doesn't quite fit. Honestly, I didn't think it was that bad. Honestly, it wasn't I didn't think it was painful. I thought it would be way worse than it was. It was very easy. The only thing I thought was hard about the whole experience was eating food with something else in your mouth. Right. Couldn't believe not enough people seem to know that there is a custom palate expander. It's not just a one-size-fits-all, and the custom will give the results. I didn't know actually what to think at first. I guess I first saw the scan at the Pain and Sleep Therapy Center. They gave me a little printout to bring to Dr. Evans. And on there, they actually showed me my throat. They said, "This is your throat." And I was like, they're like, "This is a normal throat. This is a healthy throat." And when I saw the side-by-side comparison, I thought, this looks bad. Is this bad? And they said, on a scale of 1 to 10, you're 11. I was like, okay. They were very concerned. They said that they said there are options like myofunctional therapy. There are devices you could create a custom device to bring your jaw forward while you're sleeping and things like that. They said, but honestly, in your case, the improvements would be so minor. You are a severe case. And that's when they suggested Dr. Evans. But they didn't send me straight for surgery. They actually did mention about the expansion, and that was my first point of contact, was I want to try the expansion first, because the concept of widening my nose, my airways, really spoke to me, because I had already gone through a surgery to widen my nose once, and it did not have quite as big of an impact, I think, as widening the structure, the skeletal structure did. She kind of did look at me and she was like, oh yeah, no, this is pretty severe. She was definitely like, there's no question here, you need to deal with this. Once the thought got put into my mind that, hang on, my throat is quite a bit smaller, I suddenly started to realize all the things I've always known that I didn't realize were not normal. Things like when you go to take a sip of water and you pull your jaw forward to swallow. Or when you go to, there's just 100 little things that I realized all of a sudden that it is because my throat is small. My husband knows I take too long to eat food because I chew it up to a pulp and swallow it in little bits. And I cannot have a meal without water to help me swallow things. These are all things that I thought were normal. I never questioned it. All my life when I was mouth breathing, no one ever questioned why I was mouth breathing, and if they ever asked and I said I couldn't breathe through my nose, no one ever thought that was, or said that was abnormal in any way. It took me longer. When I clicked something was off up here, it took me another 2 decades before I started to piece together symptoms across my entire body that could have just literally be coming from this one point being a restricted airway. And that's crazy to me, how many things I've gone through over the years that are very likely, probably entirely linked to it. So little things I never thought of, like Dr. Evans, I saw her yesterday, and made me, shouldn't make me realize, but I had an epiphany of why she's wearing this dress with the turtleneck, and I realized that I physically cannot stand anything touching my neck. It gives me anxiety. And she was like, is that because of your throat being narrow? It's wow, is it? It might actually be. There's so many things like that are just starting to get, my posture is awful, awful, awful. But as far as I've been, I've gone to a chiropractor and he's showed me where it should be, but when he puts me in the correct posture, I physically can't breathe. So I spent months trying to reset my bones, but then I was just in a lot of pain because my body was automatically still reaching out and forward to get the air, because I guess the least path of resistance, right? So over time that's causing my posture to change. I have a lot of back pains all through, since I turned about 15, lower back pain started, and that continued on forth. Then I start to notice things like I had a pelvic tilt, I started to have pelvic floor issues. I had a lot of heart issues. That is very interesting. I went through cardiology in Newark. They put me on different types of medications and told me all different kinds of things, and in the end they really had no idea why my heart was doing PVCs. I think I know why, but I thought it was pressure. For the longest time I kept telling them I can't wear a bra, I can't wear tight pants that are restrictive. Anything that's going to squeeze me, then I start getting them. They were like, no, it can't be that. I was like, then it has to be a hernia. Something's herniating and causing it. I said, there's no reason, I'm not any more anxious. There's nothing causing these, they're completely random, other than they happen when I have anything restrictive, or if I'm bending over, and all these things, and they kept telling me, no, that's not likely, that's not possible. I went through beta blocker, 2 beta blockers that didn't work, and eventually I went on flecainide for years, assuming that it was helping. But now I'm yeah, I actually do think it was breathing, because anything that's restricting my lungs is what's doing it. Anything that puts pressure on my lungs and is making it harder to inhale is when I start to get those PVC flip-flops. I started receiving those in my 20s, early 20s is when I first started getting PVCs. It's the same time I first started getting anxiety. And And it's when I started having a lot of sleep awakenings in panic, trying to breathe, and a lot of sleep awakenings paralyzed momentarily, trying to get the body to respond. So I think a lot of things all kind of happened at once in my early 20s. They were all warning signs that I didn't know about. And instead I adapted how I sleep and how I move and how I walk and eat more and more as my body, was deteriorating around that. So instead of, I do often wonder if I strongly kept the posture and everything as best as I could, if my body would have been forced to maybe somehow grow that way. But yes, like you said, I had orthodontics, 4 teeth extractions. They didn't offer any other options. There was no other options. In fact, I found out from my mom yesterday that she had to fight with the dentist to be given a chance to see an orthodontist. She said the only reason they let her see an orthodontist for me was because we had been to several in South Africa prior and were told that I needed orthodontic work of some kind. So she did get the orthodontist approval. He said that the only plan would be 4 teeth removals into braces, which took about 3.5 years. And in the end, my bite was still around underbite. He had straightened all the teeth out, but I still had a severe underbite. And I got fed up waiting for the braces to come off. So I can't honestly remember, but I feel like I might have just slowly started to shift it forward a little bit. What I didn't understand, and what you might also have a case of, is the camouflage orthodontics. So I guess that I bite down, I have a bite, but it's not my bite. Apparently when you relax, your jaw is going to go back to its regular position. My bite's actually back here. Where a bite? Where it actually is. So there's probably a lot of people who don't know that they are still having an underbite. Just because your teeth align in the front, it's not your regular jaw position when you sleep. And I think that's where where a lot of people might have maybe missed my issues. That I came to really seek this out is because they tell you that you stop developing skeletally around 18 to 21. You're no longer going to be developing, but that's probably true for most people. But if you're deviating from the norm and your body's actually moving out of the way to keep breathing, I guess, I was definitely still seeing further vertical growth over the years. Even though I'm an adult, I could still see further changes. My nose was further deviating and my face was getting longer still. So as between before I came and now, yes, everything looks way more harmonious. My nose hasn't physically changed. It doesn't look any wider that I can tell, but I can breathe better, so there must be something happening there. Honestly, I can't fathom how anyone wouldn't, if presented with the opportunity to do palate expansion, the benefits are just endless. And if I wasn't going to be going ahead with double jaw surgery, I think I would honestly hop on that train and do another level of expansion, because I do think it has helped a lot. And having that space that little bit of extra space for my tongue is essential in helping me swallow. I would say in the past year, I've done way better at swallowing pills. I can now swallow 4 pills in one go. I couldn't even swallow 1 pill in one go beforehand. And oftentimes if I had an infection and I was prescribed these huge antibiotics, and it was very hard for me to get them down, and I constantly would try and swallow them and bring them back out my mouth because they weren't going. And so that strange little note, but swallowing things like that has been so much easier. To realize that there was no amount of words that could come out anyone's mouth that would make up for the calculations that I could see her understanding, creating. There's no question in my mind that she fully knows what she's doing, and there's that just completely erases any fear for me of I don't want to go to someone who's going to hold my hand. I want to go to someone who's going to make sure that I'm getting the results that I need. And honestly, I did spend a lot of time looking around trying to find people that do palate expansion, and amongst those people, who does them on adults. And finding that locally is quite hard if you don't live in a major city. And honestly, even just going to places, a lot of places haven't even heard of, like, what are you talking about palatal expansion as an adult? Like, I don't know where you would go for that, Honestly, the 2 times that I've actually needed to sit down and understand what was going on, there was no question in my mind that she understood me before I even said what I was going to say. She already was ahead of me. Every time she's ever looked at my mouth, and I've never known how she does it, but she's just, instantly knows these exact little measurements and degrees, and everything's been coming out exactly as she's been predicting. So I have full faith in her. I would definitely recommend anyone who needed palatal expansion to come here, for sure, because I've gone through it, and definitely is life-changing. And I'm going to go ahead with the full life-changing effect and keep going. I want to see even more expansion. I want to have even more airspace. I want to keep going. I want to see how my life changes.